You wake up in the morning. You walk to the bathroom. You grab your toothbrush, squeeze out some toothpaste, maybe use mouthwash, maybe floss if you are the kind of person dentists pretend everyone is. And within 2 minutes, your mouth tastes like mint. Your teeth feel smooth, and you can go into the world without making people emotionally distance themselves from you. Now imagine the same morning, but it is 50,000 years ago. There is no sink, no toothpaste, no mirror, no dentist, no tiny plastic toothbrush with soft bristles and a motivational quote on the packaging. There is just you, a cave, a fire, a half-chewed piece of meat from last night, and something stuck between your back teeth that has been there since the last ice age. So the question is simple. Did ancient humans brush their teeth? Or were our ancestors just walking around with rotting mouths, terrible breath, and the kind of dental situation that would make a modern orthodontist faint? The answer is much stranger than you think, because ancient humans did not brush their teeth the way we do. But that does not mean their teeth were worse. In fact, for a very long part of human history, their teeth may have been better than ours, which is deeply unfair, considering they had no toothpaste, no electric toothbrushes, and no dental hygienist telling them they might feel a little pressure. To understand why, we need to start with something nobody wants to think about. Your mouth is not empty. Your mouth is a jungle. Right now, living on your teeth, your gums, your tongue, and every tiny corner of your mouth are billions of bacteria. Some are harmless, some are useful, and some are basically tiny criminals waiting for sugar. When you eat, those bacteria eat too. And when certain bacteria get access to sugars and starches, they produce acid. That acid slowly breaks down the hard enamel on your teeth. That is how cavities begin. Not because your teeth are weak, not because your ancestors angered the tooth gods, but because your mouth is a tiny biological battlefield, and every snack is a supply drop. Modern humans are constantly feeding that battlefield. Bread, pasta, cookies, juice, cereal, soft drinks, sweet coffee. Tiny snacks that somehow count as just a bite. Our teeth are under attack all day. But ancient hunter-gatherers did not eat like this. For most of human history, people ate whatever they could find, catch, dig up, crack open, or steal from an animal that was hopefully not still alive. Meat, fish, nuts, roots, tubers, seeds, wild fruits, leaves, bones, insects. Occasionally, something fermented, strange, or deeply regrettable. Their food was tougher, rougher, and much less processed. They were chewing through fibrous plants, sinewy meat, gritty particles, and hard seeds. Their jaws worked harder. Their teeth wore down faster. But that constant chewing may have helped clean their teeth in a very rough, very prehistoric way. Think of it as nature's toothbrush. Except instead of minty freshness, it was raw roots and the possibility of parasites. But the important thing is this. Hunter-gatherer diets generally caused fewer cavities than later farming diets. And that is where the story gets interesting. Because one of the biggest disasters in dental history was not candy. It was agriculture. Around 10,000 to 12,000 years ago, humans began farming. They started growing grains, wheat, barley, rice, maize, foods that could be stored, cooked, mashed, ground into flour, and turned into soft, sticky carbohydrates. This changed everything. Suddenly, food was not just something you hunted and hoped for. Food could be grown, stored, protected, controlled. Civilization began to form around it. Villages became towns, towns became cities, and human teeth began to suffer. Because soft, starchy foods cling to teeth in a way that wild meat and fibrous plants usually do not. Grains break down into sugars. Sticky cooked foods sit between teeth. Bacteria thrive. So while farming helped create civilization, it also helped create the ancient cavity. Which means one of the most ironic things in human history is this. The moment humans became more civilized, our mouths became more disgusting. A hunter-gatherer might have smelled like smoke, sweat, animal fat, and a wet cave floor. But there is a decent chance his teeth had fewer cavities than the average person living in an early farming village. And that feels personally offensive. Now, to be clear, ancient hunter-gatherers did not have perfect teeth. That is a myth. Their teeth were often worn down from chewing tough food and from tiny particles of grit getting into meals during grinding, cooking, or eating off the ground. Imagine eating bread with tiny grains of sand in it for your entire life. That is not a diet. That is a slow-motion sanding machine for your mouth. Ancient teeth could crack. They could wear flat. Gums could become inflamed. Abscesses could form. And if you got a serious tooth infection before antibiotics, that was not just annoying. That could kill you. A modern toothache means you call the dentist, complain, wait 2 weeks for an appointment, and Google your symptoms at 1 a.m. A prehistoric toothache meant you sat by the fire holding your jaw, hoping the swelling did not spread into your face, your bloodstream, or your brain. There was no emergency dental clinic. There was just pain. And maybe someone in your group saying, "Have you tried chewing this stick?" Which brings us to the first toothbrush. Because long before toothbrushes, humans almost certainly used toothpicks. And this is not just a guess. Archaeologists have found ancient teeth with tiny grooves between them. These grooves look like they were made by repeated scraping with something thin and hard. A twig, a piece of bone, a sliver of grass, a small wooden splinter. Basically, ancient dental floss, but worse in every way. There is evidence that Neanderthals used toothpicks to clean between their teeth and possibly to relieve gum pain. Think about that. A Neanderthal, tens of thousands of years ago, sitting somewhere in Ice Age Europe, poking between his teeth with a little stick because his gums hurt. That is one of the most weirdly relatable images in all of prehistory. No language we would recognize, no writing, no cities, no metal tools. But still the universal human experience of having something stuck between your teeth and becoming psychologically unable to focus on anything else. That might be the oldest form of oral hygiene. Not brushing, picking, scraping, chewing. Using whatever small object was available to remove food, reduce pain, or stop the mouth from feeling wrong. And if you think about it, this makes perfect sense. You do not need a dentist to invent a toothpick. You just need one annoying piece of meat stuck between 2 molars and enough free time to become desperate. From there, humans probably experimented. Some sticks were too soft, some snapped, some tasted bad, some were poisonous, which is always an unfortunate part of prehistoric product testing. But some worked. And eventually, people learned that certain twigs did more than remove food. They cleaned. They freshened the mouth. They made the gums feel better. This is where chewing sticks come in. Across many ancient cultures, people used small sticks or roots that were chewed at one end until the fibers spread out like bristles. Then they rubbed those fibers against their teeth. That is basically a toothbrush. A tree toothbrush. The most famous example is the miswak, traditionally made from the Salvadora persica tree and still used in parts of the world today. But the general idea is much older and much wider than one culture. Chew the end of a stick. Make it brush-like. Rub it on your teeth. Congratulations, you have invented oral hygiene. No plastic required. No subscription refill heads, no dentist-approved branding, just a stick and human desperation. But ancient humans did not stop there, because when your mouth hurts and you have no modern medicine, every plant becomes a possible treatment. People likely used leaves, bark, herbs, ash, charcoal, salt, and abrasive powders to clean their teeth or reduce pain. Some of this would have been useless, some of it would have made things worse, but some of it may have actually helped. Charcoal can absorb odor. Salt can help clean. Certain plants have antibacterial properties. Chewing tough fibers stimulates saliva, and saliva is one of the mouth's natural defenses. So when ancient people chewed certain sticks or rubbed substances on their teeth, they were not being primitive. They were experimenting. They were running the longest, messiest, least ethical clinical trial in human history. And the test subjects were everyone. Now let's talk about bad breath. Because you were wondering, did ancient humans have bad breath? Almost certainly, yes. But not always for the reasons we imagine. Modern bad breath is often caused by bacteria, gum disease, dry mouth, smoking, alcohol, sugary diets, and food particles breaking down in the mouth. Ancient humans had bacteria too. They had gum disease. They had rotting teeth. They had infections. They ate meat and fish and whatever else they could find. So yes, some of them probably had breath that could stop a mammoth. But there is another side to this. They were not drinking sugary soda. They were not eating candy. They were not sipping sweet coffee for 6 hours. They were not coating their teeth in refined carbohydrates from breakfast until bedtime. Their mouths were different because their food environment was different. So ancient breath was probably not fresh. But it also may not have been the non-stop sugar-powered bacterial disaster that modern mouths can become. In other words, your ancient ancestor might have smelled like smoke, blood, animal hide, and damp fur. But his mouth might not have been worse than yours after a day of iced coffee and forgetting to floss. This is where the story becomes a little uncomfortable. Because our teeth are not just personal, they are historical records. Teeth preserve evidence of what people ate, where they lived, what diseases they had, and sometimes even what they did with their mouths. Dental plaque can harden into tartar, or calculus, and that tartar can trap tiny particles for thousands of years. Plant fibers, starch grains, bacteria, proteins, smoke particles, even traces of ancient meals, which means the gross hard stuff your dentist scrapes off your teeth is, to an archaeologist, basically a time capsule. Your plaque is disgusting. Their plaque is science, and by studying ancient teeth, researchers can see massive shifts in human life. The move from hunting and gathering to farming. The rise of grain-heavy diets. The spread of tooth decay. The changes in mouth bacteria. The way civilization reshaped not just our homes, our tools, and our societies, but the inside of our mouths. That is the part nobody tells you. Human history did not just happen in caves and battles and temples. It happened on teeth. Every bite left a mark. Every diet changed the bacteria. Every new food changed the mouth. And eventually, every cavity became a fossilized receipt for civilization. Now, at some point, humans did not just clean teeth. They tried to fix them. And this is where things become genuinely horrifying. One of the oldest known examples of dental treatment in Homo sapiens comes from a roughly 14,000-year-old tooth found in northern Italy. The tooth had a cavity that appears to have been deliberately cleaned out with tiny stone tools. Imagine that. You have a cavity. There is no anesthesia, no drill, no dental chair, no little cup of water to rinse your mouth. Someone leans over you with a sharp stone and starts scraping the rotten part out of your tooth. This is not a dentist appointment. This is a trust exercise from hell. And yet, someone did it, because the alternative was worse. Pain teaches very quickly. If removing the bad part of a tooth reduced pain or slowed infection, people would remember. They would tell others. They would try it again. That is how medicine begins. Not with white coats, not with hospitals, with someone in pain, someone trying to help, and a tool that was never designed for the job. And recently, evidence has pushed this even further back with Neanderthals. A 59,000-year-old Neanderthal molar from Siberia has been interpreted by researchers as showing deliberate drilling or treatment, possibly to relieve severe tooth decay. If that interpretation holds, it means the story of dentistry may be far older than we thought, and also much more painful. A Neanderthal dental procedure with a stone tool is maybe the single worst appointment reminder in history. Your root canal is scheduled for 59,000 BC. Please arrive 15 minutes early. Bring courage. But this matters because it tells us something profound. Ancient humans were not passive victims of their bodies. They noticed problems. They tested solutions. They cleaned. They scraped. They picked. They chewed. They treated pain. They cared for one another. Even before civilization, even before writing, even before anyone understood bacteria or enamel or infection, humans knew that teeth mattered.